My name is Ralph Valle. I've been a survivor for 17 years going, and I was diagnosed in 1992. I had a radical treatment, and the cancer had escaped, and so it was a question of what to do. I decided to have an orchiectomy, which, when in retrospect, I think I should have had a shot of Lupron, but since the orchiectomy is irreversible, I live with it. I facilitate 2 support groups in Arizona, one at St. Joseph's Hospital and the other one at the Foothills Library in Glendale, which is a city next to Phoenix.
With Ed Capps and a few others, you are one of the longest surviving prostate cancer patient advocates with advanced disease. What are the important things you think we have learned over the past 20 years?
I think that what we have learned in the last 20 years relates more to more men being informed. Why? Because when I was diagnosed, the internet was in its infancy. It was very little to communicate. Support groups were hardly existing. So these days we have places like the Prostate Cancer Infolink, the PPML, the several websites that are very informative, and you could exchange with other people. And one of the most important things that exists is exchanging information and knowing that you're not alone, that there are other people on the other side of whatever it is in the world that would help you.
Does the same amount of information exist for those whose primary language in the United States is Spanish today?
I believe in Latin America and Central America, Spanish-speaking countries, even in Spain. I have a little website and we have a chat room, and only one person we have been drawing from Spain, even though there were some members from Spain. And Latin America is the same thing. I think we have a few doctors that I trade with, Dr. Premoli in Argentina, and I know that the information is not the same over there. I think that they're behind also in access to internet, so that doesn't help them.
What do you think are the critical things men should know or ask their doctor about today when considering whether to get tested for prostate cancer?
I am an advocate of screening because I think the test in itself gives a choice. I feel that men should know like products like 5-alpha reductase inhibitors like Avodart and Proscar had demonstrated a preventive prostate cancer. I think those issues are in the forefront of what men should know. They're not without side effects, but it's something that men should be aware that it exists. Men should be aware that screening with PSA is a process, and men need to be more educated. The problem that we have today is that men do not know anything about it, and as they go to the practitioner, the practitioner could say, if you don't do this, you're a dead man. And fear sets in. I know because I experienced it myself. And the education should be an 8th grade. Know that, hey, wait a second, let's look at it. There is a process. I think that active surveillance is very, very vital because many men are now diagnosed early, and I think that having that tool. Unfortunately, the problem with active surveillance is not many practitioners will follow it. So, a man is on his own. We need to get that as advocates, we need to get that across, that men need to be aware of, more educated about prostate cancer.
Many men use nutritional, herbal, and similar products in the management of prostate cancer. What are the critical things you think they need to know and do when they start down this pathway?
The tendency when you face mortality, or your own mortality, is to do something, change something, of blaming yourself for the way you maybe have been eating, even though it might not be relevant. But most of us want to change something to decide, well, maybe by changing I could arrest this. So I went mostly vegetarian. I do eat fish, and I eat turkey, but I tried to limit the fat intake. because I do believe that it. And you know, I can't deny that given the time that I was told I was going to live, which is 4 or 5 years, I'm on my 17th year, so something is working. The problem is I don't know what.
What do you think the national priorities should be in terms of prostate cancer research and education?
Well, I think that first of all, the most important thing will be to have a marker that would be very specific for prostate cancer. Research should go out there and develop a marker that takes the doubt about the case of PSA is very good for the simple reason that nobody can explain how many, why mortality has been reduced, and they don't deal with that. They say, well, we're over-treating, we're doing all the things. Marker will be a very good thing. That is, the second thing is, I think that we have to enforce prevention. Prevention by whatever method. We have a couple of tools now in the 5-alpha reductase inhibitors that should be exposed, have more exposure. I am for that. I think that another thing that should be developed is, that is important, is once the disease has recurred, to have treatments that are more effective than what we have today. Chemotherapy, provides a few months of survival, but we need something more like immunotherapies. So I'm hoping that this prevention might be something that will help, but we have to develop more treatments that. And another thing that I think is important is imaging. Have a better imaging resources so the doctors can track the progression of prostate cancer. Because I ask myself, I see the question now is, are we over-treating all these people? This is very early disease. But I see a lot of men that were diagnosed with Gleason's 3+3/6 indolent disease, and they have recurrence. So you have to ask yourself, why are so many treatments failing when we are treating so much early disease? So it's a question that is always in the back of my mind.
As the leader of a support group, do you feel men today are well educated about prostate cancer and their treatment options?
I think that the InfoLink is a wonderful resource. I think that we need more networking among men, because basically, and what I get in my support group are individuals that they know a little bit, but they don't know hardly enough, and they're seeking information. And for prostate cancer, for prostate cancer patients to be ignorant when they start trying to become PhDs after they get the disease is the wrong way of going. We should have a basic education, basic knowledge that when you go to a practitioner, they cannot, you could respond to whatever kind of line of, I don't want to say the word, but it's something that I see men come to my support group and the doctor told me that if I don't do this, I'll be dead in 6 months. And I say, my God, this is a stone age. And it's happening, it's still happening. I think not only patients have to be educated, practitioners have to be educated. And unfortunately, nothing is going to change very easily, because urologists are the ones that are very active controlling the disease. They're the ones that diagnose, and they have the decision. I like to see more urologists spreading, saying, well, we need a team effort. You should consult with a radiation oncologist. You should consult with a medical. But medical oncologists are out of the loop here, and they have to come into the loop early on, because medical oncologists don't know anything about early prostate cancer. They only see men that are already recurrent.